Hi, my name is Megan Russell. Um, I am talking a little bit about what the scope of practice for midwives are in Washington State. Uh, Excuse me. It's like almost 11 p.m. So, um, Washington State is, from what I understand and from what I can just know from talking to other midwives and what I've been reading, we actually have probably some of the most liberal rights as far as like what we're allowed to do is probably the most lenient compared to most states in the country. Um, our scope of practice includes um, uh, being CPMs are considered licensed midwives in the state of Washington. Um, we can do prenatal, interpartum, and postpartum care. We are able to care for newborns for the first few weeks of life and do, testing as far as like hearing screenings and the PKU testing on newborns. We're able to do blood work and order pretty much anything we need. I just as an observer haven't noticed anything that we weren't allowed to order to find information out, so that's pretty awesome. As far as woman care goes and gynecological care goes, we can do pap smears, routine pelvic exams, we can do cancer screenings, we're able to do breast exams. And just this year, June of last year, so 2024, we are now able to get a license extension to offer contraceptive care, including implants, the IUD, oral contraceptive, the contraceptive shot, such as like Depo-Provera, pretty much any form of birth control, we can now prescribe, which is pretty cool. We're now allowed to prescribe antibiotics outside of just in labor. So, like if a client needs one for, a UTI or BV or anything like that, we can also prescribe antivirals, which is great too, and progesterone cream. I can't remember now if we can do other forms of progesterone. Shoot. But anyway, and we can do testing and treatments for like all sexually transmitted diseases. So I feel really, really lucky. I think we're able to do more well person care than we've ever done before. I know before this, it kind of seemed like the rule of thumb and what I've seen is that once you're at your 6 weeks or 8 weeks postpartum, then that person would be out of your care. And now, because of the ability to do prescriptions for birth controls and different things, it seems as though we're able to kind of extend care more. And I would still like to see it extended. I think it makes sense to me that we should be able to take care of the person as a whole for longer term. I think when you go through a pregnancy with someone, that's almost a year of their life. And I think that really warrants like a trusting relationship and a relationship where someone's comfortable. I know personally, as a patient, I just kept not understanding, like, it just didn't make sense to me that my midwife couldn't continue to care for me because she knew me the best of anyone. And so I do believe that we should, as a whole, continue to push for more rights as far as like well person care and what we can do for our patients. Because we do get to take care of them for so long and in these really big parts of their life. So Yeah, I hope that answers your question. Thanks. Bye.